Before you say yes to veneers and spend a lot of money, watch this. Because veneers remove enamel permanently, and the plan you're sitting on probably includes teeth that didn't need to be touched. I'm Dr. Annese, implant surgeon, thousands of cosmetic cases. This will show you what to ask before anything gets prepped. When most patients walk into a cosmetic dental consult, they have something specific in mind. They might want to fix a crooked tooth, deal with staining that whitening hasn't touched, or repair a chip that's bothered them for years. They want to fix one thing, but they leave with a plan for a full set of veneers. That pattern became standard because cosmetic dentistry built a full approach that works. The idea is to look at the whole smile, design one result across all the visible teeth, and treat everything at once so it all looks the same. The logic holds out. A smile works as a system, and changing one part without thinking about the rest could look off. The full plan made sense. Then the full plan became the answer to almost every cosmetic question, no matter what the patient actually asked. A patient who wants one thing fixed gets a plan for 16. The full plan became the default because it's easier to build and easier to explain than a targeted one. When a practice designs a full smile with matched veneers across all the visible teeth, every part is controlled: the color, the shape, the spacing. The result is easy to predict because everything is done at once to one set of specs. The targeted approach is harder. To treat three teeth while keeping their fit with everything around them takes a higher level of skill and a different set of tools. It also brings in less money per case and is harder to explain in a consult than will give you a complete smile. Patients come out of cosmetic treatment with healthy tooth structure that didn't need to be touched. Veneers need a thin layer of enamel removed from the front of the tooth. Once that enamel's gone, it's gone. Every tooth that gets a veneer it didn't need has been changed forever to hold a cap it could have lived without. Patients almost never know this is happening, and nobody tells them before the prep appointment. We need to keep that in mind. Every tooth prepared for a veneer it didn't need is changed forever. If this is giving you a clearer picture before your next consult, subscribe and keep going. Every video in this series is built to give you the facts that most practices don't hand you in the consult room. How to tell if the plan is more than your goal requires. When you describe what you wanted to change, did the dentist focus on that specific thing? Or did the conversation jump straight into a full look at every visible tooth? Does the plan address the things that bothered you? Or does it treat teeth you never mentioned and you wouldn't have noticed on your own? Were you shown a digital preview of your result before any treatment was discussed? Or did the plan come without any visual of what you'd end up with? Were you given more than one option and with facts to understand what you'd be trading at each level? Or did the consult end with one plan? Did anyone tell you that prepping a tooth for a veneer removes enamel forever? And once it's done, it can't be undone. If most of those don't have a clear yes, your plan was built around the practice's standard approach, not around what you asked for. That's not always bad faith. It's often just the way the consult model works. But the result is a patient who doesn't fully understand what they agreed to or whether they needed it. A smile makeover should start with one question: what does this patient specifically want to change? The answer shapes the treatment. The treatment doesn't shape the answer. When a consult starts there, the plan looks very different for most patients. Someone who wants whiter teeth might need whitening plus 4, maybe 6 veneers on the teeth that don't respond to the whitening, not 16 veneers across the whole arch. Someone with a chip on one front tooth might need bonding or a single veneer, not a matched set. Someone who wants straighter teeth without major work might be a good fit for conservative reshaping or Invisalign, not veneers at all. The right exam uses digital tools to show the patient what the result will look like before anything is touched. The patient sees it and confirms it's what they wanted. Then the treatment gets built around getting that specific result with as little work as possible. That order of steps produces a completely different plan. The patient who come through our practice after being quoted elsewhere for full veneer plans follow the same pattern. When we ask what specifically bothered them, they point to 2, maybe 3 things. When we show them a digital preview of what fixing just those things look like, most say it's exactly what they wanted. The plan that follows treats 2 or 3 things, not 16. They needed someone to ask the right question first. Stop accepting a full plan as the only way to get a cosmetic result before you've seen a digital preview of that result. Ask what the least treatment is that gets you what the preview showed. The practice can't show you a preview and can't answer that question. The plan was built before anyone knew your goal. Start any cosmetic consult by telling the dentist in plain words what bothers you before anyone picks up a camera or a scanner. Then ask to see what fixing just that looks like before anything else is discussed. What you see in that preview is the baseline. Everything added beyond it needs a reason. The right plan gives you the result you asked for with as little tooth structure removed as possible. Most patients walk into a cosmetic consult with no way to judge what they're being offered. The Tonight test gives you specific questions that take 5 minutes to ask and will tell you more about whether the plan matches your goal than anything else. Before your next cosmetic consult, write down specific things that bother you about your smile. 2, maybe 3 at most. Use your own words, not dental terms. That list is what the consult should be built around. Step 1. At the start of your consult, hand that list to the dentist before any scanning or photos. Say, these are the specific things I'd like to address. Can we start with what it would look like to treat just these? Step 2. Ask to see a digital preview of your result before any treatment plan is discussed. A practice with digital tools can show you exactly what your smile looks like with just your specific concerns fixed before a single tooth is touched. If a practice can't show you a preview, you're being asked to approve a plan for a result you've never seen. Step 3. When the plan is presented, ask how many teeth will be prepped and whether that number comes from what you said bothered you or from matching requirements. Then ask whether a simpler approach would fix the things on your list. A practice that can answer both questions directly designed around your goal. A practice that can't explain why every tooth in the plan needs to be touched hasn't. Step 4. Ask whether any of the proposed treatment is permanent. Veneer prep removes enamel that can't be put back. Knowing which parts of the plan can't be undone before you agree them isn't a hard question. It's a question every patient deserves an answer to. The full Smile Makeover plan exists because it produces consistent, great-looking results. That's true. But it's often the answer to a question patient didn't ask. Most people who want a better smile have one, maybe two specific things in mind. Starting there and building around the least treatment that gets you what you asked for is a different kind of consult from the one most practices run. Patients who find it leave with a result that matches what they came in wanting. In their teeth that didn't need treatment stay intact. If you want to understand how a practice that handles the process in-house approaches treatment differently from the standard model, there's a video on this channel called After Watching Patients Get Bounced Between 3 Offices for 1 Procedure, I Built Something Different. It covers what an in-house practice looks like from the patient side and the questions that tell you which model you're in. The link is on the screen now.